We're at my home, and oh, hi, LKN Strategies, friends and family. We're here with Dr. Mahmoud today, and Dr. Mahmoud is just gonna kind of watch me walk through the steps that me and my wife have taken to, you know, take proper precautions.
Absolutely.
And so what I've set up out here, I'm fortunate I have a situation where I can take off my coat. I can take off as much external outside things as possible.
Perfect.
If you watched our video clip on what Dr. Mahmoud talked about, you know, the gear, really what this does is I'm touching my face relentlessly.
Yes.
And I'm wearing this all the time outside the house now because I do have a tendency to like to.
Yes.
So.
Yes. And the glasses will help with the eyes, so that's good.
Okay.
Yeah. The only other additional thing is disposal of what you perceive as, you know, the contaminated clothes that you brought in from outside. I would suggest adding either a hamper or some kind of cabinet to put all of these clothes in, and then, you know, try to make sure they end up in the wash daily. I would
keep them
suggest
outside.
Absolutely, away from everyone.
For the purpose of shooting this video, we're just not going to go beyond my kitchen. So
Okay.
we can even leave our shoes on.
Excellent. Okay.
Are you okay with that?
Yeah.
Okay. So this is normally we would take our shoes off.
Yes. And that is more important for people who have little people crawling or toddlers, a lot of contact with the floor. Yes, that is highly advisable. I know your kids are a little older, so.
What about the dogs getting it on their paws and then going on the furniture? Is that something that you should be concerned about?
It's a thought, but I don't think we have actually, to be honest, enough data. We do know that the coronavirus can live and live well in certain animals. I don't believe there are any strains that, you know, can infect like domestic pets. So dogs and cats are not necessarily some of the harboring animals, but it is zoonotic. So that means that they can infect both animals and humans as well. So for the purposes of just the house pets, you know, obviously I would recommend not taking them out actually during this time, just to minimize the chances of them getting anything on them and then bringing it into the house. But as long as you keep the home environment well, I don't think it's going to be, and contained, I don't think it's going to be an issue.
If we did take them on the walk, could we just wash their paws off with, you know, like
Certainly.
a little soap, just wipe them down?
Wipe them down,
yeah.
Or if you can find even, I don't know, alcohol wipes, just to wipe their little paws, the stuff with, you know, medical grade or something like that. You can buy them at the pharmacy.
Great.
Yeah.
So the purpose of the demonstration, where, you know, once we get beyond the threshold, walk us through, once we want to be ready to just be in the house without worrying.
Absolutely.
Okay?
Perfect. Sounds good.
So I'm gonna.
So I actually like hand washing outright, but yes, the Purell is not a bad idea, but I would still advise that probably within the first 5 minutes or so of you being at home, hand washing is still much more trustworthy and in eliminating really any microbes, not just viruses, as opposed to Purell.
So my phone is going to get into the Clorox as well.
Yes, Clorox white.
We have it white.
Perfect. And the phone is one of the largest vectors these days, actually, for harboring like infections and bacteria.
The phone is one of the largest vectors.
Yes.
Of the droplets.
Yes, exactly. Of the droplets or any microbes. So we're gonna make sure that we wipe it front and back, and then make sure that you get the areas where you're most in contact with. So the buttons on the sides and front as well.
So Lindsay has been advising me just to let it air dry.
Correct.
Okay.
And that's what's advisable with the Purell as well. You have to let it air dry. Perfect. Now we're gonna leave it here. Dispose of this where we can.
Yeah.
There we go.
Okay.
And then since we brought up the Clorox, surface cleaning, extra important especially in high, again, traffic areas, kitchen, bathrooms, because this is, again, the main way we have right now of preventing it. people who were unfortunate to have a positive case at home, I cannot recommend this enough. Surface wiping, keeping the floors clean, cleaning your bathrooms. And then the other thing, I actually was listening to the news yesterday and they pointed it out, is I would like all our viewers to just consider a plan of, should you get someone positive in the house, where are you going to quarantine them? Keeping in mind that the quarantine person needs their own room and their own bathroom. This might be a little bit more challenging in certain homes, but I just recommend that everyone at least have that contingency plan in mind. You know, like scout or sort of, you know, just plan it out, like this is gonna be the room. You don't have to do anything crazy. Hopefully you'll never have to use it, but you have to have that contingency or crisis plan going as well.
Okay. You know, I will admit again, I want to clarify this, you know, as much as we can whenever we talk. This is us talking.
Yes.
You know, I'm a healthcare guy, she's a physician. We're not advocating anything for anyone other than putting out information as we have it and to the best of our knowledge. The one thing I'm still a little squishy on is calling the Department of Health if you have a quarantine situation or you're worried about. I don't know what the response time is. I don't know the logistics of it yet. I'm sure they can tell you over the phone what you need to do, but they're likely just going to tell you to quarantine and stay home until they can direct accordingly.
Absolutely.
So if someone is sick in your home, you recommend calling their physician first or the health department?
The health department,
Okay.
actually, because and this may change in the next few weeks, but right now the testing capabilities as well as the proper instructions availability, the Department of Health is probably the best prepared at this point.
And we shot a beautiful video that is going to come online that we get into some of the science a little bit in greater detail. Again, she's a family practice physician, board certified.
Yes.
She's taking care of her family and community and her patients, and
Absolutely.
we're part of it. So, all right, next step.
Okay, so next step is, again, as many hand washing stations available. This is great, but as many hand washing stations available as you can. I would like to remind people, I can't say this enough, you want to keep washing your hands for 20 seconds. And that is so you run the water, get the soap on your hands.
I've already disinfected my hands.
If you've disinfected your hand, you can go ahead and touch it, that's fine. If you haven't, I recommend just, you know, a paper towel or something like this to switch the cap on. And then, perfect, get some water on there.
I would have been washing right over my watch, everything.
That's totally fine. And then make sure that you get into the web spaces between those fingers. Perfect. And then I want to go like this. And then we're going to go on each finger separately.
To my surgeon friends and tech friends.
Perfect.
And what I've been doing after Kevin does come in the house, and we've cleaned him off, I'm going through like the door handles that he's touched and the faucet and wiping that all down.
Excellent. That's all. I think, has it been 20 seconds? I think it's almost there.
Oh, okay. So I know a lot of people, I'll wait till the sync goes off to ask this question. Good?
Perfect. Go ahead. Excellent.
A lot of people who especially healthcare providers who are in the business of washing their hands on a routine basis. I know surgeons, they are plagued with all sorts of dermatitis and issues because they have to scrub so brutally on their, you know, my wife is already developing some, you know, some rashes, and so what's your advice?
So it is common, especially if you know yourself to be an eczema patient or someone who struggles with, you know, allergic spectrum conditions, really seasonal allergies, asthma. This could also be a possibility. So you don't want to forget skincare while you're doing the hand washing, especially that you're going to be doing it more diligently, and then the Purell has a high alcohol content, so that can be drying to the skin as well. What I usually recommend is after you've dried your hands perfectly like this and wash them with soap, is to get some Aquaphor, or if you don't even have Aquaphor, just Vaseline, and just, you know, You want to cover your hands with a thin film to retain the moisture close to the skin as much as possible, and that will prevent the removal of all the moisturizers from the skin should you need to wash your hands again.
Okay.
So yes, that's another important date.
So, assuming that I have now gotten out of my outer clothes, there would have been a place to put them outside.
Correct.
I get into fresh clothes right here.
Correct.
They're ready for me to go in. I've washed my hands.
Correct.
Am I ready to interact with my family?
Well, you could, but still maintain some kind of distance. The question or the worry I would have is if there is anything still on the clothing or the face, this area. I actually have been recommending that people take a full shower, especially if you have high-risk people at home. You can probably get away with that, Kevin, because you don't have any elderly or extremely young babies. But if you do have any high-risk population or individuals at home, I would recommend that you take a shower before coming in contact with them.
You know what? I'm going to run a little experiment here. Was one of my sons available, Graham or Fisher?
Boys.
So I'm going to practice a social distance hug without touching, because we want to greet our children when they come in. So we're gonna do a hug at a safe distance to keep our routine, right?
Okay.
So, son, I'm home.
Hi, Dad. Dad, you're home.
Yeah. Give me a big hug. All right, this is enough. Okay. There's always. Mwah. All right. Well, that will get us by for now.
There you go.
Okay. We good with that?
There you go.
Thank you, boys. Appreciate it.
Bye, Father. Bye. See you in the afternoon.
Say hi. Say goodbye to Dr. Mahmoud.
Bye, Dr.
Bye.
Bye.
Bye, boys.
So that is our presentation for now.
that's it.
We're gonna work on, getting them a little bit more concise, social media and stuff like that. I mean, people just need vignettes of information, so
Absolutely.
we're gonna continue to improve. And we're doing this for fun. We're doing this for information.
Exactly.
Obviously we want to help, and really that's the spirit of what we're doing.
That's
So thank
exactly
you for
it.
coming to my home today to do this. Today is March 19th, 2020. Thank you, Dr. Mahmoud.
Thank you both for having me.
Thank you.
It's a wrap.